Guys, let's discuss autism spectrum disorder, right? So it is a complex developmental condition that involves persistent challenges in social interaction, speech and non-verbal communication, right? And restricted or repetitive behaviors is also seen, right? So the effects of ASD and the severity of symptoms can vary widely among individuals, and hence the term spectrum is used in ASD, right? So autism is known as a spectrum disorder because there is wide variation in the type and severity of symptoms people experience, right? So people of all genders, races, ethnicities and economic backgrounds can be diagnosed with ASD, right? Although ASD can be a lifelong disorder, treatments and services can improve a person's symptoms and daily functioning, right? So now let's look at the characteristics of ASD, right? So basically ASD affects individuals differently, but there are some common characteristics basically which can be grouped into two main areas, right? So let's look at the first area, which is called as social communication and interaction, right? So here what happens is that the person faces challenges in understanding or maintaining social interactions. So that's observed. There could be let's say difficulty in developing, maintaining and also understanding relationships. That's also seen, right? So apart from that, there could be issues with non-verbal communicative behaviors used for social interaction. Example, difficulty making eye contact, a lack of facial expressions, all of that, right? Apart from that, there could be, let's say, difficulty understanding and interpreting let's say the body language, the tone of voice and expression. So that's also seen, right? There could also be, let's say, people would make little or inconsistent eye contact. So that could also be one of the symptoms. Appearing not to look at or, let's say, listen to people who are talking. That's also there, right? There could also be infrequently sharing interests, emotions, or, let's say, enjoyment of objects or activities, including infrequent pointing at or showing things to others. That's also seen, right? Let's say not responding or being very slow to respond to one's names or other verbal bits for attention. That's also seen, right? There could also be difficulties with the back and forth of conversation, right? So that's also there, right? There could be often talking at length about a favorite subject without noticing that others are not interested, or without giving others a chance to respond, right? So that is also observed, right? There could be, let's say, displaying facial expressions, movements and gestures that do not match what is being said. That's also there, right? There could be, let's say, having an unusual tone of voice that may sound sing-song or flat and robot-like. That's also seen, right? Having trouble understanding other person's point of view or being able to predict or understand let's say other people's actions. That's also observed, right? In this particular disorder, there could be difficulties adjusting behaviors to social situations as well, right? There could also be difficulties sharing an imaginative play or in making friends as well. That's also there. Now let's discuss the second aspect, which is restricted and repetitive patterns of behaviors, interests or activities, right? So here, repetitive motor movements, use of objects or speech, let's say example, it could be lining up of toys, echoing phrases and things like that. There could be insistence on sameness, rigid adherence to routines or ritualized patterns of behavior. That's seen here. There could be highly restricted, fixated interests that are abnormal in intensity or focus, right? There could also be, let's say, hyper or hypo reactivity to sensory input or unusual interest in sensory aspects of the environment. Let's say example could be indifference to pain or temperature, excessive smelling, touching of objects, fascination with lights or spinning objects and things like that, right? So that's also a symptom, right? You can also see repeating certain behaviors or having unusual behaviors as well, such as, let's say, repeating words or phrases, a behavior called echolalia is the term used for it, right? There could be, let's say, having a lasting intense interest in specific topics such as numbers, details, or facts also, right? There could also be, let's say, showing overly focused interest such as with moving objects or parts of objects. That's also one of the symptoms here, right? Also be, let's say, becoming upset by slight changes in a routine, right? Or let's say having difficulty with transitions. That's also seen, right? There could be like being more sensitive or less sensitive than other people to a sensory input, let's say such as light or sound, clothing, or temperature, things like that, right? So that's also seen. Now let's look at the causes of ASD, right? So the exact cause of ASD is not known, right? But it's believed to be caused by, let's say, a combination of genetic factors, environmental factors as well, right? So research suggests that both factors play important roles in the development of ASD, right? So let's look at genetics, right? So certain genetic mutations may increase the risk of autism, right? So ASD tends to occur more often in people who have certain genetic conditions such as Fragile X syndrome or tuberculosis cirrhosis, right? So that's also seen, right? Now environmental factors, right? So researchers are looking at the role of factors such as viral infections, medications, or complications during pregnancy, or let's say air pollutants as well. But more research is needed to establish clear links, right? So now let's look at the diagnosis of ASD. So what happens here, right? So diagnosing ASD can be difficult since there is no medical test like a blood test or let's say to diagnose all these conditions, right? Instead, doctors and psychologists, they assess the behavior and development of the individual through various methods, which involves, let's say, it could be monitoring the child's development. It could also be, let's say, some kind of developmental screening during child and therapist or child doctor visits and things like that. There could also be, let's say, comprehensive diagnostic evaluation, including hearing and vision screening, genetic testing, neurological testing, and other medical testing as well, right? So that's observed. One can say that evaluation by a team of specialists, which includes basically developmental pediatricians, there could be child neurologists and child psychologists, or even psychiatrists also, right? So that's also done for this particular disorder, right? So let's look at the treatment and therapies, right? So as you can see that while there's no cure for ASD, intensive early treatment can make a significant difference in the lives of many people with autism, right? So the goal of treatment is to basically maximize the child's ability to function by reducing ASD symptoms and basically also supporting the development as well as learning of the child, right? So treatment options, they include, the first one we can say as behavioral, psychological, and educational therapy, right? So what happens here, right? So programs that address language, social, and behavioral difficulties can help children with ASD gain self-care, social, and communication skills, right? So that can be done. Now let's look at medications, right? There are no medications that can cure ASD or treat the core symptoms, right? However, some medications can help control symptoms like hyperactivity, anxiety, or depression, right? Let's talk about family support as well. So parents and family members play a critical role in supporting a person with ASD, right? So family therapy or individual counseling can help families cope with the challenges of living with somebody who has an ASD, right? So treatment for ASD should begin, let's say, as soon as possible after the diagnosis, right? Early treatment for ASD is important as proper care and services can reduce individuals' difficulties while helping them build on their strengths and learn new skills, right? Now, people with ASD may face a wide range of issues, which means that there's no single best treatment for ASD altogether. Working closely with a healthcare provider is an important part of finding the right combination of, let's say, treatment and the services, right? So that's there. Let's talk about living with ASD patient, let's say. So living with ASD involves navigating through various challenges challenges, but with the right support and treatment. Individuals with ASD can learn, grow, and thrive, right? Understanding, acceptance, and community support are vital in enhancing the quality of life for individuals with ASD and their families, right? So that's about it. So in this video, I'm sure you have learned a lot about what is ASD, and I'm thankful to all of you all for being here and listening to this video. Thank you so much, guys.